It doesn't matter where you are. This is Dev Days US. Actually, we were planning to do this in Cleveland, which is somewhere out there. So we picked this window to talk to you. Cleveland is not that far away, and the airport is over there. And I definitely hope to take that again. It's been a long time ago. Well, welcome again, and let's just get started with some household messages, just to get you familiar with the procedures here. So this is FHIR Dev Days, and you can't have missed it. This is the 10th year of FHIR, and it's been a long journey. Look, I was lucky to be with FHIR for the past 10 years, and I got so many personal memories as well. Some of you might recognize this, you know, after a conference. It's always the same. You're left with a few more people that actually can't go home. You're watching each other. What shall we do? Shall we go out for a dinner? Well, 1 year after Dev Days, and that's this picture, we decided to go to the supermarket and go to my place and have a second Dev Days farewell actually there. That is a very dear memory for me. But let's get down to business. We're here for Dev Days. So what I'd like to do is take you through the basic structure of our program. It's not that hard. It's actually the same every day. We'll start with opening keynotes every day from noon 12, and that takes about 45 minutes every day, different keynote speakers and so on. This is for today, but I'll introduce those speakers later. After the keynotes, the real content sessions begin. So that means we'll have, main sessions, blocks of 45 minutes, which are parallel. So you have to, pick and choose, unfortunately. Every 45 minutes, there is a bio break between 1:45 and 2:15. We got lots of stuff in that period as well. But what's less clear maybe is that in parallel, again, to this, there are the fixed with FHIR sessions, which are 20 minutes, very short, practical examples of what people have done with FHIR. So while the major sessions, the main sessions focus on tutorials, the fix with FHIR focus more on, okay, how did we fix problem X or Y with FHIR? Every 20 minutes also starts at 1. If that's not enough, while this is actually pretty important, if you go to your agenda and you go to an actual session, most of the time you'll be using the Whova app. So that's in your browser or on your phone, and you can watch the presentations within Whova in video. And if you do that, you'll see this in Whova. You can ask questions on the Whova Q&A. And this is where, the presenter is presenting, but there'll be moderators, people watching for your questions, maybe answering them immediately, and if not, forwarding them to the speaker. It's also possible to go outside to actually, this is the first time, and many of you have asked for that, I want a native Zoom client to watch to my sessions. You can do that too now in the Whova app, but then you'll have to switch back and forth between Zoom and this Q&A if you want to ask questions. So don't use Zoom's own Q&A functionality, use the Q&A here. As I said, we'll monitor the chat, and actually also we'll monitor afterwards. So if you have questions afterwards, we'll answer your questions as well. Great. Apart from these main tutorial sessions and the Fix with FHIR sessions, there are tons of informal sessions. They're all on the agenda, but I just want to point out some of them to you. The meet and greet are a great way to speak to the keynote speakers. Each of the keynote speakers will later, after their keynote, be available to ask for meet and greet. And also, as well, there are fireside chats, which are comparable to some of the major figures from the FHIR community. We'll be, sitting close. Yeah, I don't know where we'll be sitting, but we'll make it a social place where you can just visit them and ask any question you always wanted to ask, basically. At the end of the day, we'll have pub talks. So these are informal talks, but we made up a few interesting subjects for you to chat about. So it's perfectly fine to pick a beer or whatever your favorite drink is, sit down in one of the pub talks and have a discussion on some pretty interesting subjects. There'll be a panel with a few experts, and you're free to join in over there. There's a 24/7 lounge where you can ask questions, and we'll make sure that there's always someone from FHIR available and from HL7 to answer your questions over there. And don't forget about the daily yoga. I've seen the program every day focuses on a different part of your body or of your brain to stay in shape while you're sitting behind your desk. All these informal sessions are not in Zoom, but they are in Spatial Chat. So I put the link there, but the links are available in the agenda as well. If you go to the Spatial Chat, you'll see separate rooms for each pub talk, you'll see the lounge for each meet and greet. So this is a little bit, less formal, and this one looks like a bar, and I can see Rinus all by himself there. So you can join the meet and greets and all these social sessions over there. And please, if you don't mind, turn on your camera to increase the social feel of these events. Well, the most frequently asked question. So here is the most important slide of the whole set. Yes, everything is recorded, provided that the speaker has allowed us to do that. So, and after actually at the end of the day, we'll put the recordings up on Whova. So exactly the same place where you saw or where you could have seen a tutorial, you will find a link to the videos of that day. So if you on those parallel blocks have to miss a certain session, you can see them actually at the end of the day or the next day. Not recorded are the informal fireside chats, meet and greets, and so on. So if you want to know what's going on there, you'll just have to join. If you still have questions, which is totally possible, I can't, cover everything that's there to say. Again, we are always in the lounge available, the virtual lounge, to answer your questions. But there is at Ask the Organizer anything category in Whova that you can use. And if that's not enough, there is access points on Zulip. And finally, you can email us. I don't know why you would, but you can still do that. Whova is also our social entry to whatever happens. So you can see the attendees there and community. And just to stimulate you a bit, we'd love to see where you're working in your surroundings. So there's a share your moments section there in the community part of the Whova. And it would be lovely if we can get a feel of who you are, where you are. No obligations at all if you don't feel like it. Just if you feel like sharing where you are, if you have an exceptional view, if you have a beautiful cat, whatever, we'd love to see your surroundings and your work environment. It's the best we can do, for all these, what is it, 530, 540 attendees here to get a feeling that we're still all together in this. Good. That's it for the formal part. Now let's get to some content. We have two keynote speakers in this general session. The first is from Allan Mustard from the OpenStreetMap Foundation. And his talk will be about, if you're not on the map, they cannot find you. Certainly true. I've depended many times during my travels on OpenStreetMap, so I'm looking forward to what Allan is going to tell us. After Allan, we'll pass the word to Gray Faulkenberry, and Gray will talk about using FHIR for vaccine tracking and recommendations in low resource settings. He promised me that next time he'll have a shorter title, but this is for today. So that's after that is Gray. And after Gray, Dev Day starts. But that's for afterwards. So all that's left to say for me is please, Allan, take the stage.
Okay, well, thank you very much for that. Can we start the slides, please? So embassies are like offices anywhere in the world. You're expected to show up for work on time and to put in a full day's effort on the job. When I was the United States ambassador to Turkmenistan, my office manager was hardworking, very conscientious, always came in a half hour before I did. had the office unlocked, the alarm system shut off, everything were ready by the time I got there. So I was rather surprised one morning to arrive to a dark office, everything buttoned up. I unlocked the doors, I turned off the alarms, I got to work, and an hour went by, 2 hours went by. Finally, Wendy, my office manager, showed up, and I had to ask what happened. She said she'd overslept because she was up past midnight and had gotten to bed late. That didn't sound good, so I said, well, what were you doing? She said, well, I was out looking for my daughter, and having raised a teenager of my own, that really did not sound good. Well, what was your daughter doing? She said, well, she'd been doing homework at a friend's apartment, and at 10 p.m. she'd called and said, I'm ready to come home, please come get me. So Wendy asked her where she was, and her daughter said, next slide, please. Slide, okay, there we go. She said, I'm in a tall white building 3 doors down from a fountain. Now, in most cities of the world, that might be useful geolocation data, but Ashgabat, the capital of Turkmenistan, it was not useful. Ashgabat is in the Guinness Book of World Records for the highest concentration of buildings with white marble facades in the world. There are literally hundreds of tall white buildings in the city and not a few on streets with fountains. So Wendy set out to search for her daughter, and it took her about 2 hours. Next slide. It was nighttime, of course, which didn't make things easier, but fortunately, Wendy had the only red Toyota RAV4 in the whole city. So when she finally drove past, her daughter saw the car and using her cell phone, called her mother and vectored her mother to the apartment building. Now, you might be asking yourself, why didn't Wendy's daughter simply provide a street address for the building, which the residents of the apartment surely knew, so her mother could zero in on it? And in spring 2015, navigation in Ashgabat was just not that simple. Next slide. I undertook to fix this problem and initially thought it would be relatively simple. I would buy Wendy a street map of the city of Ashgabat. So I went to the Geodesic Survey office in Ashgabat personally and asked what maps could be obtained. There were 2. The first was a map produced by Sofitel back when Sofitel was running one of the hotels in Ashgabat, marked mainly with 4-digit numbers assigned to streets in lieu of names during the administration of former President Niyazov. It was virtually useless for navigation. There was also a Ministry of Defense map from 2014, and the names were in English, even though what little signage existed was in either Turkmen or Russian. Names on maps don't often correspond to signage when signage even exists. Another problem was that after 1991, the names of many streets had been changed from honoring communists and Russians to honoring Turkmen and Muslim heroes and literary figures. People would give you an address, but there were no signs on that street with that name, even if there were any signs at all. Most streets in Ashgabat in 2015 did not have street signs, and if they did, the signs were not visible from the street while driving by. Both maps lack detail. Many streets are missing on both of them, and so they're virtually useless for navigation. Furthermore, the Ministry of Defense maps print run was only 300 copies for the entire city. You might ask, why didn't I go buy a map at a gas station? Well, gas stations don't sell maps. I had to seek another solution. Next slide. By the end of 2015, my wife and I had started mapping Ashgabat using OpenStreetMap. OpenStreetMap is a project started in 2004 by an Oxford student named Steve Coast, who was frustrated that there was no source anywhere of open source geospatial data that anybody could use for any purpose free of charge. Today, OpenStreetMap consists of about 1.5 million volunteer mappers, roughly 8,000 of whom are consistent regular mappers, and several hundred software developers, all but a few volunteers. OSM has local chapters in 16 countries and so-called local communities in dozens more. It's the source of the geospatial data you see on Facebook, quite a bit of Apple Maps, and it's very heavily used by Amazon Logistics. It is the base map for numerous US government web maps, including maps used by the FBI and the National Geospatial Intelligence Agency. So my wife and I started driving the streets of Ashgabat in our Toyota RAV4, weekends and evenings, using a Garmin GPS to collect data. When we started, The OSM Ashgabat map had roughly 12.5 named streets. We estimate that by the time we left Ashgabat in June 2019, we and other collaborators had named over 90% of Ashgabat's streets, plus the bulk of named streets in the near suburbs. We had also by then, with the help of a lot of other embassy employees, named the downtown streets of the 5 provincial capitals and some major municipalities, had identified most of the routes on the national highway network. Our personal contributions totaled over 250,000 data points entered, including addition of 11,500 roads and streets, and addition of over 8,000 names of points of interest. I also collected over 650,000 ground level images using a smartphone app called Mapillary, which was quite useful for adding detail to the map. As a result, not only expatriates living in Turkmenistan, but local residents began using smartphone apps to navigate. The Minister of Motor Roads told me he used the OSM map to get around, and the mayor of Ashgabat hung on his office wall a street map of his city that my embassy printed for him. Installing the OSM map on Garmin Nuvi GPS navigators allowed newcomers to the city to find their way practically anywhere they wanted to go. As a result of this work, mainly done in my spare time, in 2016, I was invited to deliver the keynote speech at the OpenStreetMap State of the Map conference in Brussels. And that was when my eyes were open to the OpenStreetMap community and the ecosystem that surrounds it. Next slide. One way of viewing the OSM community is to break it into 3 overlapping populations of volunteer contributors, data users, and corporate sponsors. The contributors provide local knowledge in the form of data collected from where they live based on what they know. The primary rule for data contribution is that the data must not be proprietary and must be freely shareable. And that the best way to do that is to be on the ground collecting original data. Some contributors offer software development services or serve on the various volunteer working groups, such as communications, membership, and operations. Data users include commercial firms, NGOs, humanitarian organizations, governments, private individuals, pretty much anybody who needs free geospatial data. The corporate sponsors provide funds to cover our expenses. The project is legally owned and supported by the OpenStreetMap Foundation, a company incorporated in England, which is responsible for raising funds to pay for our expenses. The foundation has exactly 1 employee at the moment, an administrative assistant, and is in the process of hiring its first full-time systems engineer who will be responsible for assuring server uptime. We also seek to fill a vacancy for a full-time software developer for maintaining the project's primary database editor. A few software projects have received modest financial support from the foundation, but the vast bulk of software engineering has been done by volunteers. I want to underscore that the foundation supports the project, but does not, repeat, does not control the project or what goes into the map. The quality of the database is such that several large commercial entities, including Microsoft, Amazon, Facebook, TomTom, and others, donate funds to keep the project humming. One consequence of these companies' use of the database is that some of them have hired paid mappers to contribute data as well, so that at the moment, about 17% of the edits to the map are done by paid mappers working for third parties. Amazon, for example, is interested in last mile mapping, such as driveways and parking lots. Facebook's maps are 100% from OSM data, and Facebook collaborates with some local communities to improve the maps in their areas. And if you'd like to see an interesting application of OSM, fly someplace using Microsoft Flight Simulator 2020. Its base map is the OpenStreetMap. Next slide, please. Another way of looking at the OSM community is by function. The foundation has a 7-member board of directors, all volunteers, which meets by video conference twice per month. It receives advice from an advisory board consisting of representatives of the 16 local chapters and the major corporate donors. The bulk of the work to keep the project running, however, is done by 8 all-volunteer working groups for communications, data, engineering, licensing, membership, operations, and the annual State of the Map conference, as well as the local chapters and communities working group. The mappers, of course, contribute data and work constantly to improve and expand the map. Data users develop applications to utilize the data, and in many cases, make these applications available for free or at low cost. Non-mapping contributors help the project with software projects, with organizing conferences, training, mapathons, and community activities. Next slide, please. A word about the commercial ecosystem. We really have no idea how many firms use OSM geospatial data. Aside from the big companies I've mentioned, there are many medium-sized businesses such as Esri and Mapbox, which use OSM data, and myriad small businesses, including one-person shops producing cartographic products based on OSM data. This collection of logos represents just a small representation of the small and medium-sized businesses using OSM data to generate products for their clients, taken from the Switch to OSM website. The client lists of these firms are impressive. The client lists include such well-known names as Strava, MasterCard, DHL, Vodafone, T-Mobile, Coca-Cola, Yum Brands, AXA, the National Hockey League, BMW, Renault, the National Geographic, CNN, New York Times, BBC, the Weather Company, Siemens, IBM, and TripAdvisor. US government agencies include the National Oceanographic and Atmospheric Administration, NASA, and the US Air Force. We've been contacted by companies specializing in dispatch software for emergency services and first responders, who advised that they are adding an OSM layer to their proprietary maps because OSM is often updated faster than their own maps are. If fire and police need to respond to a call from a new neighborhood that isn't yet on the proprietary map, it often already is on the OSM layer and they can find it. So we don't know how large the commercial ecosystem is or the value that it generates. We only know that last year, the consulting firm Accenture calculated that the replacement value of the OpenStreetMap database is 1.7 billion, that's billion with a B, dollars. And under the open database license, we give it away to all comers free of charge, and we only ask one thing in return, that you attribute the data to the OpenStreetMap contributors. Next slide, please. So if you want people to be able to find you and your facility, please put it on the map. Anybody can edit OpenStreetMap. Anybody can add data, and we encourage you to add yours. Please edit the map. Please jump in and volunteer. Add your business, add your NGO, add your favorite restaurants and cafes. Remember, if you're not on the map, they cannot find you. You can see the map by surfing to the top URL, and you can find our wiki at the second URL. And should questions occur to you later, you can email me at this email address. So thank you very much for that, and let's go to Gray.
Great. Well, thank you for that introduction. I'm really excited to be here. An honor to be part of the inaugural doctor's track. As Ewout said, I promise to make my title shorter next year. But I am going to be talking about using FHIR for vaccines. But first, who am I? Well, I'm board certified in internal medicine and pediatrics, so a physician by training, but I'm currently a clinical informatics fellow at the Children's Hospital of Philadelphia, at least for the next 3 weeks, at which point I will become a co-chair of the Global Health Informatics program, which we will be implementing. I'm also the director of an open source collaborative known as Firefly, and the CTO of a startup called May-June. And I have to admit, I am a little bit nervous speaking here, but luckily my partner is a psychologist and she assured me that it was just imposter syndrome. But then I showed her the other keynote speakers. She got kind of quiet, gave me a hug, and she promised that she would still love me and that I owed her a consulting fee. So what are the topics I'm going to try to cover today? I want to mention that vaccines are complicated, but I think sometimes we overdo it, and it's not always as complicated as we think it is. I want to point out and encourage other docs that we can be devs too, and talk about a use of FHIR in low resource settings and why I think FHIR is great actually for low resource settings. So I'm a huge fan of vaccines. I'm fully on board with considering them the greatest public health achievement of the 20th century. think about, have you ever met anyone with smallpox or who ever had smallpox? How about with polio, tetanus, meningococcal meningitis? Obviously, the list goes on, but I would bet that most of us have never met anyone that had these diseases. And so when I started my fellowship at SHOP, I was really excited about a partnership they have with a clinic in the Dominican Republic, Niños Primeros en Salud, where they were looking to expand and start doing vaccine recording and recommendations. They already successfully captured data about deworming campaigns. And obviously vaccines are more complicated, but it was something I was interested and excited about. And I was looking forward to being part of this project. Neither of these children are Dominican, but since I'm a pediatrician, I'm required by law to include cute kids in any presentation I give. When we started looking at the tools that were available, there's obviously a wide range that have different functionalities that we could use, starting with simple spreadsheets, which I by no means diminish because they are incredibly important and often the first step to getting off of paper and being able to collect any sort of data digitally. So with that, it moves on to more complicated data collection and ability to synthesize some of that data and evaluate it, all the way up to fully implemented EHRs and health information exchanges. Although you may have noticed something, which we did as well, I'll point it out in case you didn't, was this gap here in the middle. And that's not to say there aren't tools out there that exist in the gap and other things that can be used, but we felt like certainly our project and many projects I've seen in kind of lower resource settings fall in this range where they're collecting data or they'd like to collect data, but they'd like to be able to use it at the point of care for clinical use, but they don't have the sort of resources that are required to stand up a full EHR. And so after much discussion, we decided that we were going to have to build our own system. When we thought about it, we decided to base it on these 4 pillars. The first is really focused on the clinicians. Lots of us were driven into informatics because we're very frustrated by the tools that we use and we don't think that they're appropriate for what we're trying to do. And so we want to make something that we could use better because we do think it improves patient care. In addition, there's already brain drain and many impediments to practicing any sort of medical care in low resource settings, and we didn't want to be one more. While I pushed for it, there was still a lot of discussion about what sort of data format and data model we should use. Eventually, we came to conclude that FHIR was the right decision. I realize I'm preaching to the choir about this, but for low resource settings especially, I think it's incredibly important because if you're starting from scratch, this is a great place to start. The data is never lost. You can move it anywhere else you want. There are hosted server options from multiple places, so you're not locked into a single vendor, and you don't have to maintain it yourself if you don't have those resources. It obviously has to be mobile focused. The whole world is mobile focused, and many of the older systems were not when they were designed, and so were not really appropriate for our settings. And the 4th pillar, you'd think it should be obvious, and I shouldn't have to state it, but you have to talk to the people who are going to be using your product and the end users and really get their input on whatever you design. So when I started out, there were a couple things that I heard, including I should probably just use something that exists, even though it wasn't appropriate and didn't really fit what we were looking for. Many people said, oh, I've done that, or they've done that. Why don't you just use theirs? I heard no one really uses FHIR. Will it work with Epic? It's for the Dominican Republic, so it won't integrate with our EHR, and you'll need to find someone to build it. But I know this will shock most of you. As a physician, I have a big ego, and so I decided to go forward anyway. And I started actually, I looked around and I found that the CDC has published 150 pages of dense but really good logic surrounding vaccine recommendations. And with it, they have a lot of supporting data, including spreadsheets that you can use, so that anytime they update their data, I was able to update my rules with very little effort. The other benefit is it was very flexible. So if I wanted to say adapt their recommendations for the WHO, I could, and we've started to do that. They have 800 test cases. I have 798 correct. Hep B Hepaslav is a pain in my butt, and that one I still haven't gotten to work. We built it in Flutter, which meant it could run on a mobile device and it could run offline, both important in the settings we were looking for. And it also was nice because it was one language I had to learn, and being a physician, I didn't feel like I had a lot of time to learn multiple languages to code with. And so using Flutter, which is in a language called Dart, really helped me a lot speed up this process. I started developing some packages in FHIR, which eventually grew into this open source collaborative. For testing purposes, I was able to run in a Docker container in Google Cloud. And to make sure it fit with all the FHIR specification, the nice folks over at IMMDS IG allowed me to join their group, and I've been part of those conversations, and they've given me feedback when I had questions about how this process should work. So I was feeling really good that I got all this done, that it worked the way I wanted it to. And then I saw the guidelines that the Dominican Republic runs on, and it's this page, this one page for what we're looking at. And I realized I had completely overbuilt, what we were trying to do. So I went back and I tried to think, well, what can I salvage? Not any of that. So about 50%, maybe not a great start, but there are still some things I could, run off of. So I went back and I approached it in a way that I probably should have done to start with. We're looking at process mapping and workflows, truly understanding how they give vaccinations, coming up with questions that were really important for my logic if I was going to create a more simple logic for their guidelines, understanding what their rules were and how they made these decisions. I created some mock-ups. I did some usability testing. I started building the app. I did some more usability testing and remember to write out the scenarios in Spanish this time, because otherwise our interpreter had to continue to do it all on the fly. And that's right, if I didn't mention this before, we were working with the Dominican Republic in the middle of a pandemic. So it was all done in Spanish, using an interpreter, using WhatsApp for voice and Zoom or BlueJeans for screen sharing, because there wasn't enough bandwidth to do it all on the same platform. Nevertheless, I'm really proud of what we were able to accomplish. We do have a functioning mobile app now that records and recommends vaccinations according to their guidelines. It functions offline, but then it syncs with the server once it gets back online. It's stored in a managed cloud, which allows them flexibility to take their data where they want, but also have some control over it. It's not a single vendor and it's not something they have to maintain, but there's still multiple options for what they can do with it. And then, as I said, all the data is in FHIR, which leads to a number of byproducts, which again, I think are also really important about our project. So the Firefly Collaborative is growing. There's now a number of people around the world that are building apps in Flutter using our FHIR packages, which is kind of exciting. And they're not just doing vaccinations, they're doing things like social determinants of health and structured data capture. I have an adaptable vaccine engine, which is now sitting around, but it was kind of fun to build and I did learn a lot in the process. And I think the other piece that's really important is the clinic is now going to own their data. So previously, if they couldn't support their own server, they had to pay someone else to do it. And it was either a single vendor or it was the Children's Hospital of Philadelphia. And now they're able to have their own cloud server, which they own the data from, which is all in FHIR. And so they can move it as they want. And as they grow and expand, the data can mature and grow with them and it's not lost. All right, so I'm running over time, I apologize. But these are the points that I wanted to get to. Vaccines are good. Please get your COVID vaccine if you haven't. But remember that vaccines are much bigger than just COVID. Even though that's where the money and the attention are now, we can make tools that are going to cover all vaccines, that we can broaden the approach. And so when you're thinking about COVID, think about all the other vaccines as well. I also want to encourage clinicians to get your hands dirty and feel like you can dive in. We get pushback and we're often told our value is better as a bridger between medicine and technology. And that's probably true. There are always people that are going to be better devs, but there aren't going to be people who know more clinical have more clinical knowledge. And especially in healthcare, if a project isn't going to make money, there may be no one that's going to build it if you don't. And then lastly, again, preaching to the choir, FHIR's for everyone. It's really useful in a place that's just moving over to digital collection to know that their data is not going to be lost and it can be adapted with them. Can you imagine what would happen if we started from that perspective? Thanks to lots and lots of people who supported me in this journey. It obviously would not have been done without all of their help. This is my contact information. It will be in the slides. And thank you very much for your time. And I'll throw it back to Ewout now.
Well, thank you. Thank you, Gray. Thank you, Allan. So this was the last of the keynotes, which means that we're almost ready to start off with Dev Days. Dev Days can be a little bit hectic, so I'll tell you what happens after these 4 blocks. So the last of the tutorials ends at 5 o'clock. But at 5 o'clock, we'll have someone who's, who will visiting all the tutorials today, make notes, and then have a really nice wrap up of the day. And that is Wayne Kubik, our CTO of HL7. So Wayne, why don't you explain what's going to happen?
Well, thank you, Ewout. And thank you, all of you who are joining us here at Dev Days USA. I've got my Dev Days mug here from 2018. It's my favorite mug, keeps things warm or cold for hours. I've also got my yellow Dev Days shirt on. It seems to have shrunk a little bit over the year, maybe about since last year. I don't know. My wife says it's my COVID-12, but I think it's the shirt. Anyway, each day at the end, as Ewout said, I'll be trying to give a brief summary of some of the key points and queue up what's coming up on the next day to help you plan your sessions. Won't keep you too long because we want to get to those pub talks later, of course. And it's a little gray and dreary here. I'm back in the Chicago area again, but if the sun comes out, we'll take a little walk in my wife's garden too, and so get a sense of what it would be like to be, more pastoral atmosphere. Cleveland, which we hope to see most of you, many of you, all of you, and many more next year, isn't exactly pastoral either, but it's kind of a fun location over there on the waterfront. So we're all looking forward to getting back together again. So I will see you later today. I would like to officially, on behalf of HL7 International, welcome you and thank you for joining us at Dev Days 2021. And really looking forward to a great day's meeting. Thanks.